Good evening, friends. I'm Dr. Meghna Ved. I'm a consultant homeopath and a backflower therapist practicing in Ahmedabad since last 20 years, running my clinic Daivik Homeo Care. And today I'll be talking about bedwetting or nocturnal enuresis in kids. Now, nocturnal enuresis is usually a condition in which the child passes involuntarily urine in bed at night. It could be once or twice. Now, up to 3 to 4 years, it is okay, but even after 5 to 6 years, if the child continues to do the same thing, then it becomes a matter of concern and has to be treated. Okay, now let's talk about the reasons. One of the most common reasons in children could be worms. If the child is suffering from chronic worm conditions, then bedwetting is apparent, so it needs to be corrected. Second is out of habit or out of laziness. The child is so tired after a whole day of activity that the child doesn't feel like getting it at night. So it could be out of habit or laziness. Third is genetic. If any of the parent is having had this complaint, or any of the elder sibling is having this complaint, it's very apparent that the child also suffers from bedwetting. Okay. Fourth is could be weak bladder muscles. If the urinary bladder muscles are weak, in that case bedwetting can occur because the urine is not able to be retained in the bladder for a long time. Then it could be due to vitamin D or omega-3 deficiency. It's very common these days as children are hardly exposed to sunlight nowadays. So vitamin D deficiency can also lead to complaint of bedwetting. And one of the most common reasons is any underlying emotional trauma. If the child is suffering from some kind of fear, or if the child is feeling rejected after the birth of a second child, or could be because of some emotional trauma like death of a loved one, death of a pet, or some dispute going on in the family, usually the children are not able to express themselves fine, and it gets expressed in the form of bedwetting. So if there is any underlying emotional trauma or stress, then this could also lead to this complaint, so it has to be treated accordingly. Fine. Now let us talk about what are the steps that can be taken. First is reduce the fluid intake of the child after 7 o'clock in the evening. Reduce the amount of fluid the child is taken. Second is reduce the amount of sugar, sodas, colas. Fine. If you reduce the sugar intake, it will definitely improve this complaint. Third is improve the sunlight exposure. Involve the child more in outdoor activities, at least half an hour in a day. That is very important. Include seeds and nuts in order to improve the omega-3 levels in the child. Fine. You have to definitely treat the underlying cause. Fine. Find out if the child is suffering from any emotional trauma at school, in the home, in the neighborhood, and try to address it. And the most important is do not ever reprimand, scold, or embarrass the child about it. If you do so, the complaint will definitely worsen. So treat it in a very peaceful and in a very understanding manner. Fine. So these are the steps that can be taken, and if there is worms, definitely anti-worm treatment has to be taken. So because that could be underlying cause of bedwetting. Without any reason the child keeps on wetting the bed even after all the other complaints have been addressed, so there could be some underlying worm problem. Fine. So now let's talk about homeopathic line of treatment. One of the most common remedies which I am using in bedwetting is equisetum. I use it in mother tincture form, 10 drops twice in a day in half cup of water. It works wonderfully in any kind of bedwetting, idiopathic, without any cause, out of habit. If there is bedwetting, equisetum works wonderfully. Second remedy is tuberculinum. I give it as intercurrent doses every 15 days or once in a month. I give tuberculinum. It is a wonderful remedy in bedwetting, usually in children who are restless, hyperactive during the day, and out of laziness, out of tiredness, out of habit, they have this complaint. Okay. Now third remedy which I am using is sepia. If there is bedwetting, especially in the first part of the night, that is before up till 12 to 1 o'clock, and the urine is very offensive and dark colored, then sepia works wonderfully. Other remedy is causticum. Causticum 30 I give at night. It's a beautiful remedy if bedwetting is due to weakness of the bladder muscles. Fine. So these are the common remedies which I am using. Other than that, there are many beautiful remedies like belladonna, calcarea carb, but these can be decided only after taking proper history of the patient, and always advisable to start treatment under a qualified homeopath. Now let's talk about backflower medicines. Common backflower remedies which I am using is hornbeam. It is a very good remedy if bedwetting is out of laziness, out of habit, and due to weakness of the bladder muscles. Hornbeam works. Hornbeam and olive. Olive helps to improve the strength of the muscles. So hornbeam and olive, these two work wonderfully in cases of bedwetting due to weakness of bladder muscles or due to exhaustion or tiredness in children. Other remedy which I am using is white chestnut. In order to, either the child is having this repetitive cyclic habit of wetting the bed daily at night, In order to break this habit, white chestnut is the remedy which I am using. Other than that, there are remedies like mimulus if the child is suffering from any fear, or Star of Bethlehem if the child is suffering from any kind of emotional shock or trauma and bedwetting is occurring after that. So there are many beautiful homeopathic and backflower remedies in order to treat this complaint, and it works wonderfully and can treat bedwetting on a permanent basis. So stay safe, stay carefree, choose homeopathy. If you have any doubts or any queries, you can DM me, or you can message it in the comment section. I would try to solve your queries as much as I can. And stay happy, stay healthy, choose homeopathy. Bye.